the American Nurses Association, the American Medical Association, representing millions of nurses and doctors who know our healthcare system best, they've announced their support for reform.
President Obama, of course, pushing for health care reform and announcing which medical associations are behind him. Our next guest is the former president of the American Medical Association, but he warns of disaster in the details of President Obama's health plan. Dr. Donald Palmisano joins us. He's now the spokesperson for the Coalition to Protect Patients' Rights. Doctor, thanks for being here this morning.
Pleasure, Allison. Thank you.
The American Medical Association, the AMA, which you used to run, has endorsed the president's plan on this. What are they missing that you think could be disastrous?
Well, I love the AMA, but I think they made a mistake in endorsing this plan. First off, what we want to do is have the patient in control of the policy. We want the patient to own the policy, and we want government out of the examining rooms and the operating rooms. The AMA has very strong policy for medical liability reform among our top advocacy items. We also have the right to privately contract, where you and I, as patient and doctor, can agree on a fee. Whatever the government would pay would be a defined contribution or an amount, and we would agree less or more than that. But that is prohibited in H.R. 3200, the Tri-Committee bill. This is an essential right of liberty, the right to privately contract. It's a hallmark of the free enterprise system.
When you say medical liability reform, is that another term for tort reform?
It is.
And that's not in this bill.
No, it's not. And if the president doesn't like proven reforms, such as California and Texas, if he doesn't like those reforms, then come up with alternatives. But don't say, oh, well, we're going to look at that. We don't want somebody looking over your shoulder. Well, we got to get rid of the generalities. Eloquent generalities won't cut it right now. We need to have the American public in charge of their own lives, with the doctor as trusted consultant.
Tell us how you think this plan, as it exists in the House, will hurt patients.
What it will do, first off, it will eliminate the so-called public plan. The government plan will eliminate the private insurers. They're the umpire. They're the umpire. They're going to set all the rules, and eventually there'll be no private insurers. Then you'll have the government. What we ought to do is just take a deep breath, let everybody read the bill, understand the bill, and then let everybody in Congress get on perhaps Medicaid for a year and get an idea what government-controlled medical care can do. What happens is, by rationing prices, they end up no doctors in the area to take the patients.
Meaning, because if prices go down, you just price doctors out of the field altogether.
Sure.
Doctors cannot afford to practice medicine while they're paying these onerous insurance costs each year. I know doctors who pay more and more in malpractice insurance every year, though their salaries don't go up.
That's true. Think of Gulliver's Travels. You got the giant of medicine all tied up with rules, regulations, and price fixing, and so the doctor can't operate on the patients.
What is the solution, Dr. Palmisano?
The solution is to, number one, let the patient own the policy.
Meaning, but right now it's through your employer. Is it different?
You can do it any number of ways, but the main thing is that the tax subsidy or the tax credits or the defined contribution, everybody gets the same benefit. So if I, as a solo practitioner, or you as a solo practitioner, if you didn't work for Fox, you would get the same tax credit. That if you spend $5,000 on your insurance, you would get a credit against your insurance. Against your income tax. Sure. Every year. That would be one thing. Number two, the patient would have the right from an array of choices to choose the insurance. They could make prudent choices like health savings accounts, where the money stays in every year if they don't spend it. They have catastrophic coverage over that. And we need to have any decisions on quality. Let the specialty societies give us the guidelines. But we're going to end up with these mandates that cause long lines, rationing. We have experiences in Canada. We have experiences in Great Britain. And when President Obama talked the other night, when he says, and doctors, you know, make the choice of doing the tonsillectomy because they get more money than the medical treatment, gee whiz, give us a break, Mr. President. I mean, let's trust the doctor. The patients certainly do.
Dr. Palmisano, thanks for coming on this morning and making it understandable. I appreciate it.
Okay, thanks a lot.
Thanks so much.
Thank you very much.